Heel spur, not with me, the radical path to a pain-free life. Why this book? Heel spurs are a common foot condition that affects many people and can significantly reduce their quality of life. The pain caused by a heel spur is often so severe that it interferes with daily life, including the ability to walk, work and participate in sporting activities. Despite the prevalence of this condition and the intense pain it can cause, there is often a gap in easily accessible, understandable and comprehensive information for sufferers. This book was written to fill that gap. It aims to provide sufferers of heel spurs with comprehensive and understandable guidance on how to treat, prevent and manage their symptoms. It is not only a medical guide, but also a guide that addresses the emotional and psychological challenges that accompany chronic pain. It aims to encourage and empower readers to take active steps to relieve their symptoms and improve their quality of life. Chapter 1. Understanding what heel spurs are. Anatomy of the foot. The foot is a complex structure of bones, joints, muscles, tendons and ligaments. It consists of 26 bones, 33 joints and over 100 muscles, tendons and ligaments that work together to provide movement and stability. The heel, which forms the back of the foot, plays a crucial role in walking and standing. The main bones of the foot are the calcaneus, heel bone, the talus, ankle bone, the metatarsal bones and the toe bones. The calcaneus is the largest bone in the foot and bears the weight of the body when we stand and walk. Above it is the talus, which plays an important role in connecting the foot to the leg and allowing the foot to move. The plantar fascia is a thick band of connective tissue that runs from the heel to the toes. It supports the arch of the foot and absorbs the forces generated by walking and running. If this plantar fascia is overstressed or injured, it can lead to inflammation and micro tears, which promotes the development of a heel spur. Definition and causes of heel spur. A heel spur is a bony growth that forms on the underside of the heel bone. This growth occurs in response to chronic inflammation and stress on the plantar fascia. When the plantar fascia is subjected to excessive stress, it can separate from the heel bone, causing micro tears and inflammation. The body responds by forming calcium deposits at the site of the injury, which eventually leads to the formation of a bony spur. The most common causes of heel spurs are overuse of the foot due to intense sporting activities such as running or jumping, poor foot mechanics leading to uneven loading of the plantar fascia, wearing unsuitable footwear that does not provide adequate support and cushioning, excess weight, which puts additional pressure on the feet, age, as the plantar fascia loses elasticity with age, risk factors and predispositions. Several factors can increase the risk of developing a heel spur. These include age. As we age, the plantar fascia loses elasticity and becomes more susceptible to injury. Weight. Being overweight puts additional strain on the plantar fascia, which increases the risk of inflammation and heel spurs. Sports activities. Sports that require intense strain on the foot, such as running, jumping or dancing, increase the risk of heel spurs. Foot deformities. Certain foot deformities such as flat feet or a high arch can increase the strain on the plantar fascia. Occupational stress. Jobs that require long periods of standing or walking can place excessive strain on the plantar fascia. Symptoms and diagnosis. The typical symptoms of a heel spur include sharp pain in the heel, especially in the morning after getting up or after sitting for a long time. Pain during exertion. The pain often worsens when walking, running or standing. Swelling and inflammation. The heel area may be swollen and inflamed. Diagnosis of a heel spur is usually done through a physical exam and a patient's medical history. The doctor will examine the heel for pain and inflammation and ask when and under what circumstances the pain occurs. Imaging tests such as X-rays may be used to visualize the heel spur and rule out other possible causes of the pain. Medical and naturopathic perspectives. Treatment for a heel spur can include both medical and naturopathic approaches. Medical treatments focus on relieving pain and reducing inflammation. These include drug treatment, painkillers and anti-inflammatory drugs, physiotherapy, exercises to stretch and strengthen the plantar fascia and surrounding muscles, orthopedic insoles, special insoles that support the foot and reduce pressure on the plantar fascia. Shockwave therapy, a non-invasive method that uses high-energy sound waves to promote tissue healing. Chapter 1. Understanding what heel spurs are. Continued. Medical and naturopathic perspectives. Continued. Naturopathic approaches focus on treating the body holistically and encouraging the body's own healing powers. These approaches can be used in combination with conventional medical treatments to achieve the best results. Naturopathic methods include acupuncture, a traditional Chinese method that uses fine needles to stimulate specific points in the body and relieve pain. Acupressure, a similar method to acupuncture, but without needles. Instead, pressure is applied to specific points. Homeopathy, the use of highly diluted substances to stimulate the body's self-healing powers. Herbal medicine, the use of herbal preparations to relieve inflammation and pain. Nutritional therapy, a diet that includes anti-inflammatory foods and aims to reduce excess weight to reduce pressure on the feet. A comprehensive treatment plan can combine elements from both perspectives to promote healing and reduce pain. Working with an experienced physician and a naturopathic doctor can help create a personalized treatment plan tailored to the patient's specific needs. Chapter 2. Preventive measures. Proper foot care. Proper foot care is crucial to maintaining foot health and preventing problems like heel spurs. Here are some important aspects of foot care. Hygiene. Wash your feet daily with warm water and mild soap. Make sure to dry your feet thoroughly, especially between the toes, to avoid fungal infections. Nail care. Trim your toenails regularly and straight to prevent ingrown nails. File down sharp edges. Skin care. Use moisturizers to keep the skin on your feet soft and supple. Be careful not to apply cream between the toes to minimize moisture and the risk of fungal infections. Foot baths. A regular foot bath can be relaxing and improve circulation. Add Epsom salts or essential oils to the water to aid healing. Selection of suitable footwear. The right footwear plays a crucial role in preventing heel spurs. When choosing shoes, pay attention to the following criteria. Good fit. Shoes should fit well and be neither too tight nor too loose. Make sure your toes have enough room and are not squeezed. Support. Choose shoes with good arch support to reduce pressure on the plantar fascia. Orthotic insoles can provide additional support. Cushioning. Shoes with adequate cushioning in the heel area help absorb the impact of walking and running and reduce the strain on the heel. Quality. Invest in high-quality shoes that are made from breathable materials and have a sturdy construction. Tips for weight control. Being overweight can increase pressure on the feet and increase the risk of heel spurs. Here are some tips for weight control. Healthy diet. A balanced diet rich in fruits, vegetables, Whole grains and lean protein can help maintain a healthy weight. Avoid processed foods, sugary drinks and excessive calorie intake. Regular exercise. Regular physical activity is crucial for weight control and overall health. Choose activities that are fun and can be incorporated into your daily routine, such as walking, cycling or swimming. Mindful eating. Pay attention to your eating habits and try to eat consciously and slowly. Avoid emotional eating and pay attention to your body's signals when you are full. Ergonomic adjustments in everyday life. Ergonomic adjustments can help reduce strain on the feet and prevent discomfort. Here are some tips. Workstation design. Make sure your workstation is ergonomically designed. Use a footrest if you sit for long periods of time and make sure your chair and desk are the right height. Posture. Maintain good posture when standing and walking. Distribute your weight evenly between both feet and avoid staying in one position for too long. Movement breaks. Take regular breaks to relieve pressure on your feet and promote circulation. Stretch your feet and legs during these breaks. Exercises to strengthen and stretch the feet. Targeted exercises can help strengthen the muscles of the feet and stretch the plantar fascia. Here are some recommended exercises. Plantar fascia stretch. Sit down. Place a towel around the ball of your foot and gently pull the towel towards you until you feel a stretch in the plantar fascia. Hold this position for 15-30 seconds and repeat 3-5 times. Calf muscle stretch. Stand facing a wall. Place your hands on the wall and step back with one foot, keeping the back leg straight. Bend the front knee until you feel a stretch in the calf. Hold this position for 15-30 seconds and repeat 3-5 times for each leg. Strengthening the foot muscles. Place a towel on the floor and try to crumple it with your toes. This exercise strengthens the foot muscles and improves stability. Chapter 3. Acute Pain Management. Immediate measures for acute pain. When acute pain from a heel spur occurs, immediate action is needed to relieve the pain and reduce inflammation. Here are some immediate measures that can help. Rest. Avoid activities that may aggravate the pain. Give your foot the rest it needs to recover. Elevate. Elevate your foot to improve circulation and reduce swelling. Elevate the foot higher than the heart to promote blood flow. Application of cold and heat therapy. The use of cold and heat therapy can help relieve pain and inflammation. Cold therapy. Apply ice to the affected area for the first 48 hours after pain appears. Wrap the ice in a cloth to avoid skin damage and leave it on the heel for 15-20 minutes. Repeat several times a day. Heat therapy. After the first 48 hours, applying heat can help promote circulation and relax muscles. Use a warm towel or heating pad for 15-20 minutes. Painkillers and their use. Painkillers can help relieve acute pain and reduce inflammation. Common painkillers include non-steroidal anti-inflammatory drugs, NSAIDs. Medicines such as ibuprofen or naproxen can effectively relieve pain and inflammation. Make sure to only take these medications after consulting a doctor and do not exceed the recommended dosage. Paracetamol. This painkiller can help relieve pain but has no anti-inflammatory effect. It can be an alternative for people who cannot tolerate NSAIDs. Alternative methods. Acupuncture and acupressure. Alternative methods such as acupuncture and acupressure can also help relieve pain. Acupuncture. This traditional Chinese therapy uses fine needles inserted into specific points on the body to reduce pain and promote healing. Acupuncture can stimulate the release of endorphins, the body's natural painkillers. Acupressure, a similar technique to acupuncture, but without needles. Instead, pressure is applied to specific points to relieve pain and promote blood flow. Case studies and experience reports. This section can present case studies and testimonials from people who have found successful methods for pain relief. These personal stories can inspire and provide practical insights into different treatment options. Chapter 4. Long-term treatment methods. Physiotherapy and targeted exercises. Physical therapy can play an important role in the long-term treatment of heel spurs. An experienced physical therapist can create a personalized exercise plan aimed at stretching and strengthening the plantar fascia, as well as strengthening the muscles of the foot and lower leg. Here are some exercises that are often recommended. Plantar fascia stretch. This exercise helps stretch the plantar fascia and improve its flexibility. Sit down and place the affected leg over the other knee. Gently pull the toes back until you feel a stretch in the plantar fascia. Hold the stretch for 15-30 seconds and repeat several times a day. Calf muscle stretch. This exercise stretches the calf muscles and can help relieve pressure on the plantar fascia. Stand with your hands on a wall, one foot in front of the other. Bend your front knee and keep your back leg straight until you feel a stretch in your calf. Hold the stretch for 15-30 seconds and repeat several times a day for each leg. Strengthening exercises. Exercises such as raising and lowering your heels on a stair step or grasping towels with your toes can strengthen foot muscles and improve stability. Orthopedic insoles and aids. Orthotic insoles and other devices can help reduce stress on the plantar fascia and promote healing. Here are some options. Orthopedic insoles. Special insoles that are inserted into the shoes can support the arch of the foot and reduce pressure on the plantar fascia. Insoles can be customized to meet the patient's specific needs. Night splints. These splints keep the foot in a dorsiflexed position, bent upward, and stretch the plantar fascia while you sleep. This can help reduce morning pain. Heel cushions. Soft cushions placed in the shoes can cushion the impact of walking and reduce pressure on the heel. Drug treatment and injections. In some cases, medication may be needed to relieve pain and reduce inflammation. Options include oral painkillers and anti-inflammatories, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen can effectively relieve pain and inflammation. However, these should only be taken under medical supervision. Corticosteroid injections. In severe cases, the doctor may administer corticosteroid injections into the affected area. These injections can reduce severe inflammation and promote healing. However, it is important to note that repeated injections can weaken the tissue. Shock wave therapy. Shock wave therapy is a non-invasive treatment method that uses high-energy sound waves to promote tissue healing. This therapy can help reduce pain and improve function by stimulating blood flow and metabolism in the affected area. Shockwave therapy is typically performed in multiple sessions and can be an effective alternative to more invasive treatments. Surgical options. In rare cases, when conservative treatments are unsuccessful, surgery may be considered. Surgical options may include removing the heel spur or exposing the plantar fascia to relieve pressure and reduce pain. The decision to undergo surgery should be carefully discussed with a doctor who can weigh the risks and benefits. Chapter 5. Complementary therapies and home remedies. Natural anti-inflammatories and dietary supplements. Complementary therapies and home remedies can provide valuable support in treating heel spurs. Natural anti-inflammatories and supplements can help reduce inflammation and promote healing. The most effective natural anti-inflammatories include turmeric. Turmeric contains curcumin, a compound with powerful anti-inflammatory properties. Turmeric can be used as a spice in the diet or taken in supplement form. Omega-3 fatty acids. These fatty acids, found in fish oil and flaxseed oil, have anti-inflammatory properties and can help reduce inflammation. Ginger. Ginger also has anti-inflammatory properties and can be consumed as a tea, spice or dietary supplement. Bromelain. This enzyme, found in pineapple, has anti-inflammatory and analgesic properties. It can be taken as a dietary supplement. Massage techniques and self-massage. Massage techniques can help improve circulation, relieve muscle tension, and reduce pain. Regular massage can also help speed healing. Here are some techniques you can try. Self-massage of the plantar fascia. Sit down and place the affected foot on the other knee. Use your thumbs to apply pressure to the plantar fascia and massage it in a circular motion. Start at the heel and work your way down to the toes. Perform this massage daily for 5-10 minutes. Rolling with a ball. Use a tennis ball or a special massage ball and roll it back and forth under your foot, applying moderate pressure to stretch and massage the plantar fascia. This technique can also be performed daily for 5-10 minutes. Application of essential oils. Essential oils can have a soothing and anti-inflammatory effect. They can be used in conjunction with massages or as a foot bath. The most useful essential oils for treating heel spurs include lavender oil. Lavender oil has anti-inflammatory and analgesic properties. It can be used for massage or in a warm foot bath. Peppermint oil. Peppermint oil has a cooling effect and can help relieve pain. It can be diluted with a carrier oil and used for massage. Tea tree oil. Tea tree oil has anti-inflammatory and antiseptic properties. It can be used in a warm foot bath to reduce inflammation. Home remedies for pain relief. Various home remedies can help relieve pain and promote healing. Some proven home remedies include vinegar compresses. Dip a cloth in a mixture of warm water and apple cider vinegar and place it on the affected heel. Vinegar has anti-inflammatory properties and can help relieve pain. Baking soda paste. Mix baking soda with a little water to create a paste and apply it to the heel. Baking soda can help reduce inflammation and relieve pain. Salt water baths. A warm foot bath with Epsom salts can help increase circulation and reduce inflammation. Epsom salts contain magnesium, which can relieve muscle tension and aid healing. Chapter 6. Lifestyle changes for prevention. Dietary changes to reduce inflammation. A healthy diet can go a long way in preventing heel spurs. Certain foods have anti-inflammatory properties and can help reduce the risk of inflammation. Here are some recommendations for an anti-inflammatory diet. Fruits and vegetables. Fruits and vegetables are rich in antioxidants and inflammation-fighting nutrients. Berries. Green leafy vegetables. Tomatoes and peppers are especially recommended. Whole grains. Whole grains like oatmeal, quinoa and brown rice contain fiber and other nutrients that help reduce inflammation. Fatty fish. Fish such as salmon, mackerel and sardines are rich in omega-3 fatty acids, which have anti-inflammatory properties. Nuts and seeds. Almonds, walnuts, Flax seeds and chia seeds are also good sources of anti-inflammatory omega-3 fatty acids. Healthy fats. Use olive oil, avocados and coconut oil as healthy fat sources in your diet. Stress management and its role in pain relief. Chronic stress can increase inflammation in the body and hinder healing. Effective stress management techniques can help reduce pain and promote healing. Proven stress management techniques include meditation. Regular meditation can help reduce stress and promote relaxation. There are several techniques, including mindfulness meditation and guided meditation. Yoga. Yoga combines physical exercises with breathing techniques and meditation, which can help reduce stress and improve physical fitness. Breathing exercises. Deep breathing exercises can help calm the nervous system and reduce stress. Try to take a few minutes each day to consciously breathe in and out deeply. Walks in nature. Spending time in nature can help calm the mind and reduce stress. Regular walks outside can have a beneficial effect. Regular exercise and its benefits. Regular exercise is crucial for preventing heel spurs and overall health. Exercise helps control weight, improve circulation and strengthen muscles. Here are some tips on how to incorporate regular exercise into your daily routine. Walking. Regular walking is an easy and effective way to exercise. Try to walk for at least 30 minutes every day. Swimming. Swimming is a sport that is easy on the joints, trains the entire body and minimizes the risk of injury. Cycling. Cycling is another low-impact activity that strengthens leg muscles and improves endurance. Strength training. Regular strength training helps to strengthen muscles and improve stability. Focus on exercises that target the leg and foot muscles. Chapter 7. Experience reports and success stories. Success stories of those affected. Personal success stories can inspire and give hope. In this section of the book, sufferers share their experiences with heel spurs and how they overcame their pain. These stories offer valuable insight and practical advice. Anna's story. Anna, a passionate runner, suffered from heel spurs for years. Through a combination of physical therapy, dietary changes and regular stretching, she was able to overcome her pain and run pain-free again. Marcus' experience. Marcus, an office worker, developed a heel spur due to long periods of standing and walking on hard floors. By using orthopedic insoles and targeted exercises, he was able to significantly alleviate his symptoms. Interviews with experts. Interviews with professionals from various fields of medicine and naturopathy provide valuable insight and expert advice. These experts share their experiences and recommendations for treating heel spurs. Interview with Dr. Muller, orthopedist. Dr. Muller talks about the latest treatment methods and gives tips on preventing heel spurs. Conversation with naturopath Ms. Schmidt. Ms. Schmidt explains how naturopathic methods such as acupuncture and herbal medicine can support the treatment of heel spurs. Chapter 8. Frequently asked questions. Frequently asked questions. Answers to frequently asked questions. This section answers frequently asked questions about heel spurs. The answers are intended to provide clarity and practical advice. What are the main causes of heel spurs? The main causes of heel spurs are overloading of the plantar fascia, incorrect footwear, excess weight and misalignment of the foot. How long does it take for a heel spur to heal? Healing times may vary depending on the severity of the condition and the treatment methods used. Typically, it may take several months to achieve complete healing. Can heel spurs be treated without surgery? Yes. Most cases of heel spurs can be successfully treated without surgery. Conservative methods such as physical therapy, orthopedic insoles and home remedies are often sufficient. Are orthopedic insoles really helpful? Orthotic insoles can be very helpful as they support the arch of the foot and reduce pressure on the plantar fascia, but they should be individually fitted for best results. Which sports are recommended for heel spurs? Sports that are gentle on the joints, such as swimming, cycling and yoga, are recommended for heel spurs. Avoid high-impact activities such as running on hard surfaces. Rights and ownership notice. This audiobook is published and distributed by Testberichtdienste LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testberichtdienste LLC. Testberichtdienste LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtdienste LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testberichtdienste LLC. All rights reserved.